Hello friends, on 8th of May, world is celebrating World Thalassaemia Day. So I am going to answer the few questions today. So what is thalassemia? Thalassemia is a blood disorder where there is a problem in the formation of the hemoglobin. There is a continuous low level of hemoglobin in the body. There are the two type of thalassemia. One is called as a thalassemia minor and one is called as a thalassemia major. The minor person can live life normally, where the major with a person with the thalassemia major require the frequent blood transfusion and his or her lifespan will be the short. So, what precaution to be taken to avoid this deadly disease? If you are planning to marry, you should have your thalassemia report before your astrological consultation. If you find after the marriage you are both thalassemia minor couple, then there are the few tests that help to detect the whether your baby has a thalassemia or not. What are this tests? One is called as a CVS, chorionic villus sampling, that to be done around 11 weeks of pregnancy, where the part of placenta is taken and sent for the genetic analysis whether this baby carries a thalassemia minor, major or normal. So if that baby happen to be major, then you need to undergo the abortion process. With advancement of IVF and genetic techniques, now we are able to do this detection before anybody can conceive. So what is this advanced technique? That's called as a pre-genetic testing for monogenic disease, where husband and wife undergo the certain pre-genetic checkup and they will identify which gene defect are present and they are responsible for the thalassemia process. Once this genetic defect is identified, they will undergo IVF procedure. They generate the embryos, and once these embryos are generated, these embryos are tested for the particular genetic defect, and they screen out the embryo that are major, minor, or normal. So when after that couple undergo embryo transfer procedure with the thalassemia minor embryo or normal embryo. So baby has either thalassemia minor or normal. So you can remove that risk of abortion and complication and mental trauma associated with the abortion. One most important thing, when certain time what happened, couple married, they produce a child and the child suddenly found to have the thalassemia major. So for the next pregnancy, what we can do it? Whatever the test I suggested, that can be done. The another technique is known as bone marrow transplantation, where we do the IVF procedure, we do the HLA matching with in utero baby with the current baby, and the stem cell that is generated at the time of delivery of the baby are infused in the thalassemia major affected baby, so he or she can live normally. This is called as a savior baby. There are the many cases in India that underwent for this process. So if any couple is planning the pregnancy, do the thalassemia test. It's a simple blood test. It's costing 1500 rupees. If you are married and planning the pregnancy, better to do this test. If you are already pregnant and if you are not done this test, please do this test. Thank you very much.